Good morning, everyone. My name is Dr. Kaylee Garrett-Silverman, physical therapist, owner and founder of FEM Empowerment and Advocacy Concierge Physical Therapy in Tampa Bay. And I wanted to hop on and just give you an idea and answer a few questions that I keep getting this week and in general. One of the questions is, what is pelvic floor physical therapy? And pelvic floor physical therapy is the physical therapy portion that adds in your pelvic floor. So that is the muscles between the legs, anything that has to do with pooping, peeing, and sex, pretty much. So we deal with that on top of what we already know orthopedically. So what we know with the low back, what we know with the core, what we know with the hips, with the legs, all of the musculoskeletal expertise is still there. All of the neuromuscular expertise is still there. We still pay attention to the exercise progressions, and we still pay attention to muscle strength and endurance. Also with coordination, we just add in that extra expertise. So that's what pelvic floor PT is. And the next question that I always get is, when do I need to see one? I always recommend that you see a pelvic floor physical therapy, especially as a woman. I always recommend you see one before getting pregnant. So when you decide that you want to try to conceive, during pregnancy, and then also postpartum, before menopause. You want to go in all different ranges of your life or phases of your life. I think it's important for all women to always have a pelvic floor assessment. It's important for you to know what's going on down there, paying attention to what's normal for you, and then figuring out what's not normal, and then going to see a professional who is trained in helping you treat that. We treat all kinds and a variety of different diagnoses, from endometriosis to vulvodynia to chronic pelvic pain to pelvic pain, pain with intercourse, diastasis recti, pain during pregnancy. We treat pubic symphysis dysfunction. I treat incontinence. I treat constipation. There's all of the different diagnoses that I can treat and more. And I would love to answer the questions that you might have for that. Now, what is a pelvic floor physical therapy assessment or evaluation like is another question that I've been asked. That question is a great question. Everyone does it a little bit differently. The way that I do it is I will first talk to you through a history. I want to know your medical history. You're going to fill out some paperwork for me to give me an answer to many of the questions that I already have. We're going to talk about what's going on or what symptoms you're having, if you're having symptoms, or if this is a checkup. We're going to talk about different pains. We're going to talk about different movements. I'm going to watch you move. I'm going to get as much information from you as I need to before putting my hands on. Then I'm going to watch you move into squats, into lunges. I'm going to watch you walk. I'm going to watch you pick things up. I'm going to check your strength. I'm going to check your range of motion and flexibility. We're going to look at your diaphragm and the way that you breathe. I'm going to look at your core to see which muscles are activating, which ones are not activating. I'm going to take a look to see if everything's working together. And that is all before I look at internal assessment. So then we go into that process, which we make you as comfortable as I can going into that process. It's not always necessary, but when it is something that I think is highly beneficial. So hopefully that answers your questions about what pelvic floor PT is, when to see one, and what it's like. If you have any more, please drop them below and I will make sure and answer those tomorrow.